Welcome to the Inspired by Jacqueline podcast, a refreshing place for women struggling with entrepreneurship, faith, or infertility. Stay tuned for today's episode. So welcome everyone to Inspired by Jacqueline. I'm excited about our next special guest, Dr. Ana Flores Locke. And let me tell you that our interaction when we connected for the first time, I felt like it was part of a journey book. And we went to an event. I went to say hello, and it was just like we were reading each other's minds, and there was such a connection with our journeys that it was very special for me. So I'm really looking forward for you to tune in. And just to give you a little glimpse, because as you know, I don't share the full bio, but you will find out more about her. Dr. Ana Flores, and I'll just call her Ana for now. She is an international award-winning author and educator, but she is also the founder and owner of Shalandra Counseling Services. I hope I said it correctly.
You got it.
And it is a mental health and infertility counseling center. So this is why, other than her being amazing and she just has this amazing spirit about her, a glow and a great energy that I felt around her, that when she said that she was a counselor and in mental health and all about infertility, it was just like something just clicked there. And I was like, oh my goodness, this is a great avenue and a connection for anyone who's looking for resources or a counselor or mental health professional that is in the infertility journey. So without further ado, welcome, Ana. Tell me a little bit more about you if you want to share right now. Thank you so much for being here. Yes.
Sure. No, thank you. Thank you. Thank you so much. Like you said, we both kind of had this instant connection, especially when I do connect with my sisters on the infertility journey, because as Latinas, we don't talk about it.
Yes.
And that's my mission, to move us from we don't talk about infertility or mental health to yes, let's talk about it, and let's talk about it now. So I'm so excited to be on this podcast with you, because our words and our stories and what we're about to share is going to invite and encourage others experiencing what we went through and are going through to speak up, to seek out mental health support that they need.
And I'm so thankful because of the connection, because Latinas, as myself, and I'm including myself, it took me 30 years to actually publicly say and start speaking about it, because I started seeing more and more conversations or a little glimpse of colleagues and friends and people that I was coming across that was like, oh, I don't talk about it much, or it was kept in a little private conversation. And we shouldn't be ashamed about it. But our culture, coming from a Latina culture, it kind of, puts it underneath that rug. So I know that we're going to have that conversation.
Yes. Yeah. There's so many cultural factors in our community that does it inadvertently shames us, right? And I know it's always out of love, and it can then become shame, and we'll talk about it some more. But yes, in our culture, we definitely, with surrounding fertility and becoming a parent, and when there's struggles, it is very taboo, and we don't talk about it because we can't help but feel as a Latina woman that we're failing in some way, and we're not meeting that Latina obligation to be a parent.
And I'm sure other cultures go through something, but I personally feel, maybe because I'm being biased that I'm Latina, I feel that we have that stronger, I don't know what to call it, just a stronger sense of the culture that it really pushes us to hide things.
Yeah.
So tell me a little bit about, since we're talking about you, tell me a little bit about how your infertility journey started.
Sure. So I was Roman, a Catholic schoolgirl. Went to Catholic school my whole life, went to high school, Catholic high school, all girls high school. I followed that good girl Catholic path. And I met someone, we got married in a Catholic church, beautiful wedding, beautiful ceremony, and immediately wanted to have children and become a mother. And I say I did kind of that correct right path because that's part of this story, especially for us Latinas, when we think about how religion influences family building, because I thought, oh, right, I'm doing everything correctly. I should just be pregnant now. And nope, we were not pregnant. And it was 3 years trying to get pregnant.
Wow.
And we weren't able to conceive. And so there was that religious aspect of like, why is God punishing me? Like, why is this happening to me? I followed the correct path, and is happening, right? Why is this happening? That I know a lot of women struggle with. And so for those 3 years, we struggled. And in the midst of that journey, we also faced family comments. So
those unwanted comments.
I call them reproductive microaggressions, and which are those little unwanted comments made out of love, but they can be very hurtful, right? Like, when's the baby coming? It only takes 5 minutes. What are you guys doing? Like, yes, we are having sex, okay, and we are not getting pregnant. And so we had to face not only the failure of not being able to get pregnant naturally, but also the family comments that amplified we were not pregnant for 3 years.
So the 3 years, was it that it took 3 years that you didn't go to a professional to find out why?
Yeah, I mean, that's another aspect, right? With our community, again, we, and being a strong Latina, I thought, just keep working hard, right? I could figure it out. I can solve this. And obviously now I know, in retrospect, having a medical condition, which infertility is a medical reproductive condition, that I could not do anything to fix it without medical care.
Right.
So yeah, it took, I think 1 year, because actually to get the medical diagnosis of infertility, you have to have unprotected sexual intercourse for 1 year. So I had to reach that 1 year mark. And then after that, it became my husband, and more my husband of like, just be patient. We'll just wait. It'll happen. So a lot of postponing getting medical care because of his own fears of like what was wrong. And so out of fear, we just postponed. He waited out. Exactly. And then year 2 hit. And then I guess the Latina temper in me came out, and I was like, we need to go to a doctor. That's it. We're going. And plus a friend of his is actually his wife used the doctor we used to get pregnant. And so when he had a friend that shared in this experience and connected us to their doctor, then he was more on board. So then by year 3 is when we actually sought out help from a doctor. And then it took that 1 year to get pregnant.
Wow. And what was the diagnosis, or was there a diagnosis as to the why, or was it unknown?
It was unknown. It was unexplained.
And that's one of the hardest, I feel, because mine was also unknown. It's like, okay, first you're telling me you're this whole big story about infertility, which I had no clue about. And now you're telling me it's unknown. You don't know where it's coming from. And, these possibilities of how you can receive help may or may not help.
Yes. Right. Yeah. It's a weird spot to be in. You're right, because it's a medical condition. Yes, there's a diagnosis, and yet it's unexplained. They don't know how you got it, why you got it, what exactly treatment's going to help you get pregnant. It is very much trial and error, and it takes a long time. And that's one thing when I work with clients who are going through the journey, is to really give them that reality that this is a long journey. A lot of us think because we want to be moms so bad that by the time we go to a doctor, I'm going to be pregnant in a month or in 2 months. I'm going to be pregnant. And the statistics show that 30% really actually only get pregnant from treatment. And it takes many, many months.
So with that said, what were your next steps? Like, how did you
Mhm.
proceed ahead? And I know personally your story, but if you can
Mhm.
share your journey on what your next steps were and the results.
Sure. So, and my story is I wrote a book about it that is published.
Which
It's
is
called,
amazing. And I'm
thank
going to
you.
share that in the show notes.
Fantastic. It's called Body Betrayal. And that book was a healing process for me.
Mm,
And we could talk more about that, but in there is my whole journey. And so, in a nutshell, basically, we sought out the medical treatment and did first start because of religious reasons. And
mm,
some of us may know or may not know, but the Roman Catholic Church does have certain guidelines regarding reproductive treatment. Well, there's certain things they condone and certain things they don't allow.
mhm.
And so, as a Catholic person, as a Catholic Latina, I wanted to follow more of a holistic, natural method first. So I
Right.
sought that treatment out to, again, try to conceive naturally and align with Catholic viewpoints. And that didn't work. So then the
Mhm.
next doctor, we went to like a secular hospital that followed the more scientific procedures. And we did that, and that didn't work. And so that second doctor, too, one biggest lesson that I came through with this journey was to have an emotional connection or a positive emotional connection with your providers.
Mm.
Because that second doctor, when I had the intrauterine insemination,
The
IUI,
IUI.
uh,
I'm very familiar.
so many alphabet soups and so many, and like you share, Jackie, and we'll talk about it. It's like I'm a mental health counselor for more than 18 years.
Mm,
But when I went through this journey, I knew nothing about infertility, nothing about all of these IUI, IVF, none of that stuff. So I learned
mm,
along the way. So anyway, so what happened though? We had a failed cycle. I didn't get pregnant,
mhm,
and I was crying. I was upset, and the doctor just was callous with me.
mm.
And again, I think as a Latina woman, I want that connection. Like, I
Yeah.
need you to be sympathetic.
Mhm.
And so I told my husband, we're leaving that doctor. So we went to the third. Third was our charm.
Wow, number three.
She, number three, she connected with me emotionally. She gave me emotional support. She comforted
Mm,
me. She called me herself as well. A lot of the other doctors have their nurses call, but she called, we connected. And so that's one lesson learned on this journey to becoming a parent is really connecting on an emotional, empathic level with your providers,
I
because this is
agree.
such an emotional roller coaster that you need that support
Mm.
along the way.
I agree because I know I only had two, which was my OB/GYN and then the reproductive specialist.
Mm-hmm.
And I had the reason I left, even though I was going to seek out a specialist, but I left right away my OB because of that empathy, the lack of empathy that was there. And it was kind of like, oh, insurance, insurance, insurance,
Mm-hmm.
payment, 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 and
Mm-hmm.
all of this that it cracked me at
Mm-hmm.
one point, and I just was like, just everything came out. I was just crying uncontrollably in the clinic, and I was like, how can you be so,
Mm-hmm.
unempathetic? No empathy here,
Mm-hmm.
and you asking me for money, and I
Mm-hmm.
didn't even know the laws changed with the insurance. So,
Mm-hmm.
because when I was going through it, and I think it's similar, and you can, if you can share with insurance, that at one point, it can be covered, and at another point it can't.
Mm-hmm.
And so
Yeah.
that was one of the frustrations that led me to find the reproductive doctor. And I was so blessed that I found a really amazing doctor.
Mm-hmm.
And even though, I did have him call me at times, but the nurses, but everyone there was so amazing, and such an empathetic office that, yes, you do need, especially as a Latina.
Yes, especially.
you know,
Yeah.
I think we're more emotional. I don't know.
Yeah.
I know I was.
Yeah.
So it just makes a difference.
It makes a difference. And also, I mean, yes, I mean, I think we are emotionally passionate people just culturally. But when you add the layer of trying to have your baby, trying to be a mother, I mean, that level of emotion is to some of us who want to be mothers, like a core, just, I don't have words for it because it's so powerful in that the emotion of wanting to be a mother. For me, it
Yeah.
was very, very strong, right? Like that was my goal, and that is my life. That's what I wanted, and
Right.
it was very much encouraged and reinforced in our culture. Right?
Mm-hmm.
That's really what's
Yep.
valued for women, is to be mothers. And so you add that layer on top of, okay, we're emotional and we need emotional connection, and we're failing and we can't get pregnant,
Yeah.
right? And we're not able to meet that goal of
Mm.
becoming a parent. Just really amplifies how devastating
Yeah.
and how disastrous going through infertility can feel.
Yeah. And so, how long was your journey and your process, and what was the results of it?
Yes, I'm sorry.
No,
I get
it's okay.
distracted from all these aspects of the
It's okay
journey.
because it's a lot.
It
It's
is a lot.
totally a lot. There's one thing that, incites another to
Right.
remember. It's like, wait, this happens for this. And so
Exactly.
I get it. No.
It's a web. It's a web. It's a web of connections. But yes, so actually by year 3, when we found the third doctor, and we did IVF at that point, and I was so blessed and so lucky to only have to do one cycle of
Mm,
IVF, and they call it harvested.
right.
Sounds such a harsh word, but they harvested a lot of eggs, and they offered a lot of them fertilized.
Hmm.
And one of these aspects of infertility is how it's a numbers game. So
Mm,
the numbers, it's
yeah.
as far as, okay, they got, I don't remember the numbers myself, but let's say 15 eggs, maybe half of them live,
Right.
and then they get fertilized with, for me, I was able to use my husband's sperm. So our children are genetically linked to both of us. And I mentioned that because there is donor sperm, there's donor
Hmm.
eggs. And that's a whole nother episode.
Right.
And but for us, we were able to have genetically linked
Awesome.
kids, and we had embryos that developed. And then my
Hmm.
doctor called and she said, all your embryos look strong. You want to put in one or you want to put in two? And this was 10 years ago. And 10 years
Mm.
ago, I was offered the option to put in two. Now that has changed. They only put in one. It's too high risk for
Oh,
mother and
wow.
babies to, most times, they only put in the one embryo.
Wow.
But 10 years ago, and this is how fast technology changes and ethics change around
Yeah.
infertility. But 10 years ago, she was like, oh, you want one or two? And I said two. I said, I'm okay with twins. And part of that is also because, and we're going to talk about faith and
Hmm.
religion. I believe in, I call it God winks, right? These little
Hmm.
moments in life that start to add up towards an outcome. And as a kid, I remember playing the game of life, and
Mm, I remember.
remember, and I would land on twins. I'd get twins, add my two little twins into my little car. And then, and then my mother had a set of twins as cousins. And
Wow.
then, yeah, and then my vision board, which is part of a recommendation I give to a lot of my clients, is to make a vision
Hmm.
board. On the vision board, the image of the babies were twins.
Mm.
So I had all these little God winks for twins that I was at that point knew, okay, I'm okay with twins. And so she put in two embryos and they both stayed. And I
Mm.
was pregnant, and
Awesome.
so I was very blessed. One cycle, one time with implantation of embryos, and I was pregnant.
And
The journey,
how long was the journey? How long did it take from when you started? You started in year 3, so how
yeah,
long?
year 3. Let's see, I was pregnant in May. We might have started the year before.
Okay.
So 6 months
So
at least.
it was in year 3 then.
Yeah, I think so.
Okay.
Yeah,
Okay.
May of year 3, we were pregnant.
Okay. Yeah, and I'm glad that you explained that because like we just said a few minutes ago, this whole conversation is a web of different factors, different
Mm-hmm.
things. And like for me, you mentioned, fertilized eggs and all that. And I think I learned recently on how baby girls when they're born with all of these, eggs,
Yes.
millions of eggs, and as they're maturing
Mm-hmm.
you lose eggs.
Right.
And so by the time 30 years ago, I don't want to subtract how old I am, but 30 years ago, when I was going through everything, even though it was unknown, they were saying that I didn't have enough eggs. My egg
Mm-hmm.
count was low, and but it was also not attaching.
Mm-hmm.
So whatever eggs were there were not able to fertilize.
Yeah. Okay.
And so, that was another like, okay, I don't understand this.
Mm-hmm.
But
Right.
just, yeah. And like we said, it's just so many different factors that it's not even an easy conversation to have just
Mm-hmm.
one conversation, just a
Mm-hmm.
full straight conversation without touching on so many different things. So I'm really excited for you. And,
Thank you.
when at that point that I was in, I felt like I was in a dark black hole,
Mm-hmm.
and that I just kept on falling every single time because
Mm-hmm.
it's that cycle. And in one of the episodes, I chatted with another specialist who has this 2-week program thing, and we were having a 2-week conversation. Those 2 weeks feel like the end of the earth
Yeah,
is,
the
is
2 week wait.
coming.
Yeah.
It's like only 2 weeks, and
Mm-hmm.
imagine you feel one day is long, two
Right.
weeks waiting for that
Mm-hmm.
process. And so how did you, or what type of therapy, or what did you do other than, or was it just the vision board that distracted you, or how far did your
Mm-hmm.
emotions take you?
Yeah, yeah. And again, I mean, it's ironic, right? But I'm
Hmm.
a mental health counselor and I didn't think about going to therapy throughout this
Yep.
journey.
Yep.
I just went into my survival mechanism is
Mm,
to actually numb out my emotions and go very much into kind of like action mode, problem solving
mhm,
mode. This is what I need to do. Doctors are telling me to do this, I do it. This appointment, I go to. This blood work,
mhm.
I do. So I got into that mode, which is, I guess, just that, again, my mechanism for not being overloaded by the emotions.
Right.
Now, of course, anger happened, disappointment happened, and my husband got the brunt of it because I didn't
Mhm.
share this with anybody between him and
It's
I.
hard.
It's hard. And like you said, Jackie, that element of like, how can I have a conversation with a family member at a barbecue when they ask what's going on, when
Mhm.
we can spend 5 hours talking about,
Exactly.
and then
And and this is us knowing
don't,
about the conversation.
they have no knowledge. They just think, again, have sex, relax, have sex, you get pregnant.
Yeah.
And it's a whole world, a whole community of information and people related to infertility. So there isn't that background knowledge. So now you have to kind of explain as you're sharing
Yeah.
your story. So it's very hard. It's very hard. So I isolated. I
Mm.
kept to myself, along with that shame and stigma of there's
Mhm.
something wrong with me. I don't want to share that. I don't want
Right.
people to see that. And the other ironic factor is being a counselor, I didn't go to therapy. And then one of my aunts also had some like infertility journey because she had a brain tumor that affected her
Mm.
hormones to get pregnant. And I would have been someone who had some knowledge, had some way to connect with me to talk it over, but I just didn't reach out
Mm.
and connect. So I think my healthy distraction was work, just
Mm.
work and go to doctor's appointments. And I also did maintain my faith. That was the one stable aspect for me. Like I kept faith that I was going to be okay.
Mm.
I was going to be a mother in some way, somehow. It
Mhm.
just was going to take longer. You know, my husband and I had a strong relationship, so we were aligned and we were doing it together, and he helped a lot as well.
Mhm.
So I think that's what, and then my connection with my doctor
Mm.
too.
Okay.
Those
And
elements is what
so, and
helped.
then you mentioned you were mental health in professional.
Mhm.
Was it in infertility at that time, or did that come afterwards? Like, tell me what type of mental health provider you were and how that came about into
Mhm.
adding infertility.
Yeah. So no, when I first started as a mental health counselor, I was doing depression, anxiety,
Mm,
psychiatric concerns, children, parenting, families, those types of things. And it wasn't until I had my own
mm-hmm,
infertility journey and I wrote my book and I got into my healing process that I then really turned my life's pain into my life's purpose
mm,
with my work. And so now that's where I really focused on helping other women go through their infertility journey because look, like I said, I was a counselor and I
yeah.
didn't get counseling.
You're
I
like, I
mean, I
know
wish I
everything there is.
did. I know. I wish I did. I do wish I did. It would have been so helpful. And now I see it helping clients who do seek out mental health support throughout the journey.
Yeah.
Because one thing that reproductive doctors do tell me is, for the most part, for a lot of women, they have the technology to get them pregnant. What happens is the psychological stress tends to lead to dropout. Patients decide to not continue because of the psychological stress. So the doctors do share with me how vital it is to have a mental health provider on your journey, because we can help you keep your stamina, because we can help you through the emotional stuff. The doctors do the medical stuff. You combine those two, you are able to keep going until you can't get pregnant or decide on whatever next path is for you.
Yeah. And I'm glad that you mentioned that, because I think I waited. I remember, I'm trying to remember 30 years back, but I do remember, the doctor mentioning that it would be good to have a counselor or psychologist, etc., for me to speak to. But at the time, like going back to the Latina thing, that, I'm like, oh, yeah, no, I don't need to speak to anyone. And that isolation piece of, no, I need to keep this to myself and my partner. And the only people I did, because I was going to church, I did share it with some of the people at the church as we had smaller groups and meetings, but it wasn't like the same. They were very supportive, but it wasn't the same because of the conversation we just had a few minutes ago. It's easier to speak to someone who knows about the journey versus not, because you're like explaining 3 times more. Right. And so that brings more frustration, that brings more sadness, that brings just a whole revolution of emotions. Right. And so I did venture out because it was like my last little whim of decision making. So I reached out to a psychiatrist or psychologist. I'm not sure what she was at the moment. And there was no connection because I didn't feel, even though she was on the list of, infertility counseling or whatever, there was no connection. I didn't feel, I felt like it was bland. I felt like, not that I was there for her to tell me what to do, but even in me sharing, there was no connection. I felt like I needed the same type of connection as I did with my doctor. And so it was the first and the last. And so after that, I prayed on it a lot. And for me, I had seen other friends and colleagues, a few around that same time, that were into adoption. And I was a part of that with them. And I saw the fact that adoption is not 100%. And I wanted a specific, if I was adopting, I wanted a specific type of adoption. I wanted a baby. And so I saw someone that I knew go through that process, and that first interaction, it was taken away from them because someone changed their mind. And so I was like, oh my gosh, I felt this deep, like, hurt, like I don't think I can do this again. So with me, it was more about the emotions that I knew I couldn't handle anymore. And it was either my survival or me moving on, to this darkness that was going to just take everything away. And so I was in that journey of trying to see what can happen for 10 years. And it was just too long. And where there was sometimes hope, it was just like, oh, let's try it again. Oh, let's try again. And it was just so repetitive and so much like drain and all of that, that I was like, I'm going to turn back. I can't do this anymore, because I felt like I was losing myself, my soul, spirit, my everything. And it was faith. So going back to that conversation of faith that you mentioned, for me, my faith in God was what saved me. That's what I feel saved me completely. I'm able to speak about it right now and feel this release, this joy that I'm here and I chose life, no matter if it was, I was expecting life, to give life and to have a child, but I chose my life, and I feel so amazing that
Mm-hmm.
we have choices. And I'm
Mm-hmm.
glad that you shared that, it's not about just giving up. It's just about we have so many choices, but
Right.
knowing that there are options and resources.
Mm-hmm.
So for me, it was that faith and holding
Yeah.
on to it. So if you can
Yeah.
share a little bit, elaborate on, just what faith does for you. How does faith build positivity during uncertain times?
Mm-hmm. Yeah. That's a great question because that's really what faith does.
Mm-hmm.
Is give you positivity during uncertain times. And not only positivity, because the reality is someone who works with emotions is not always positive.
Right.
Not at all, right? And they're the emotions of disappointment and sadness and
Mm-hmm.
anger, those are valid as well and need to be
Yep.
honored. So we still have faith when we have those emotions too. And it really is the uncertainty because it's so uncertain and because
Mm-hmm.
there's so much ambivalence and there's so much unknown. Faith being stable, faith by definition being certain, faith by definition being the foundation, the rock,
Mm-hmm.
is what counters the uncertainty and unknown.
Right.
It's like that counterbalance.
Yeah.
So for me, that's what faith equals. And especially for us in our society, like we want to control. We want to know the
Mm-hmm.
answer. We want to,
We
we
want
want
it
to
now.
exactly, we want it now. And then faith reminds us, okay, we don't know the answer. We may
Mm-hmm.
not have it now. And we don't know what is God's path for us either. And I loved how you said your story, Jackie, because like I shared, statistically, it's only 30% that
Mm-hmm.
get pregnant. What happens with the other 70%?
Right.
Some, like you said, adopt. Some decide to remain childless.
Mm-hmm.
And that's your story. And I love how you share it because it opens those possibilities
Mm-hmm.
for the choices around
Right.
parenthood. And even if you look in the Bible, like there's examples of mothers
Mm.
who did not have their own children.
And you know what? I
And
just want
they,
to interject there.
yeah.
So I was in such a darkness, and I was going religiously to church every week, and even small study groups, et cetera, et cetera. And it was this, I was just oblivious that I couldn't make that connection that I'm reading the Bible, that I'm reading about, was it Sarah or I forget who it was that was, barren, but I couldn't make the connection. But I was like, oh, it's in a book. It was someone that it happened years ago. That doesn't happen now. Like that's how my mind was connecting. But yes, in the Bible, it definitely shares stories.
Yeah, yeah, exactly. And that's who I had in mind, Sarah and Abraham. Right?
Yeah.
Sarah was barren, and Abraham is known as the father of all of us, our faith father.
Yeah.
And they didn't procreate genetically linked children. God blessed them with children of
Mm-hmm.
faith. And so that is also something I've learned recently too
Mm.
along this journey and working with other clients is and hearing your story is yes, there is this aspect of even though in our culture we only know the one way to become a
Mm-hmm.
mother, right? You
Right.
get pregnant, you procreate, you have
Right.
genetically linked kids. And now no, that's not the case. You could have, again, donor created
Right.
offspring. You could have surrogates to carry your children. You can
Mm-hmm.
adopt. You can be mothers to other children in your life who you did not give birth to. And that is just as significant and powerful because
Yeah.
it's a role we're talking about, being a
Yeah.
mother. Being a
Yeah.
mother
And
doesn't automatically come because you're pregnant and have a kid.
right.
Not at
That
all.
doesn't mean being
Yeah.
motherhood. And there was a conversation that I had in a few episodes ago about motherhood, that,
Mm-hmm.
we're still in this journey of motherhood. It doesn't take that away from us.
Yeah.
It's just, like you said, it's infertility is a disease. It's
Mm-hmm.
a
Mm-hmm.
condition that is valid and it exists.
Yeah.
It's just everything that comes with it is not, simple to understand,
No.
which is why I am happy to, have this conversation with you and know that you are in position and have your own platform to actually be a resource, be a
Mm-hmm.
mental health professional who is there. And I am an advocate for that because I feel that there's so much unknown, even if they tell you it's PCOS or whatever it is. Oh,
Mhm.
it's because of this. Oh, it's because of that.
Mhm.
Even though you may know what causes it, it comes with so much emotion.
Mhm.
And even though maybe you're not Latina, if you're listening to this, it comes with so many emotions. It's just
Mhm.
Latinas, I just feel we're too
Mhm.
passionate.
Yes, yes, and that's what makes us amazing. I mean,
Exactly.
yes.
And so tell me about like what resources you offer. Tell me about your company and what you offer.
Yeah. And so I'm so, again, blessed and happy to be a resource.
Mm-hmm.
My biggest asset for people going through the journey is having gone through it as well, because that shared experience not only allows me to connect emotionally, empathically with you, it also validates for you what you're
Mm-hmm.
going through, because
Right.
I went through it too. And of course, everyone's story is unique, but
Yes.
that added component of, like you said, when someone can tell me, yeah, I've done IUI, I know what that means. When
Right.
someone tells me
Right.
my ovaries are swollen, I know what that feels like. You know, I have to give this injection and it hurts. I know what that
Oh.
feels exactly, right? So that is right there, just brings that connection, that sense of
Mm-hmm.
relief. And I'm also Latina. And so
Mm-hmm.
if you're Latina and you're struggling to get pregnant, it's
Yeah.
just a perfect match
Right.
because you get the cultural component, you get
Mm-hmm.
the life experience, and the professional expertise,
Right.
because I've been a mental health counselor for more than 18 years and I've written a book on it. And I have many hours now of training in infertility
Mm-hmm.
counseling, and I work with reproductive doctors. So all that really combines to give that resource, the emotional support with the expert knowledge to really keep you on that journey and help you make
Mm-hmm.
those hard decisions. I just
Wow.
talked
Yes.
about the options, explore the choices
Yeah.
while not losing yourself in the process.
So true. So
Mhm.
true. To change the lane a little bit,
Mhm.
tell me about how you currently take care of yourself or your
Mhm.
mental health and just take time for you and your family.
Yeah. So I have my own therapist. So I
Mm,
talk to someone now. I go to the gym in the
mm,
morning. That's my non-negotiable. I get my endorphins and I release
yeah.
my stress by going to the gym. And it gives me my social time there too, because I make friends there. I have friends there.
Hmm.
And now I am being more intentional about spending time with friends, making
Mm,
those date nights with my friends, and with my children, also being intentional about protecting my time.
mm,
So I'm protective of my time in terms of
right.
what I decide to say yes to and what I decide to say, well, right now that's not going to benefit me. I would
Mm,
rather spend time with my kids. So I'm able to, as I'm also faculty and I have the summers off. So that
oh,
helps
okay.
me
And
a lot.
faculty at
Lehman College in the Bronx.
awesome.
So I teach in their clinical mental health counseling program. And I love that because not only I'm mentoring and supervising counselors to be, I also get the summers off to be with my kids. And
Awesome.
so I'm very intentional about spending time with them and doing things that they enjoy. So going to the gym, spending time with my friends, date nights, spending time with my kids,
Awesome.
that all really, and seeing my therapist,
Yeah.
that all helps. And that all is keeping
That
me
is
afloat.
no, that is awesome.
Yes.
And you know, I've been in my industry and my business for close to 25 years, and I'm hearing more now in different conversations the word intentional. So I'm glad that you mention it because it's very important with
Mhm.
your time and how being intentional makes it reality. I
Right.
think, right? It
Mhm.
makes it gives it a purpose.
Yes.
And I am now, similar to what you say, choosing the time. And,
Mhm.
whether it's my husband and I, and one of the things that would frustrate me maybe a few years ago or something, as far as being compared, like I felt at times that families that, or women that have family, right,
Mhm.
that would take their kids to school, to soccer practice, etc. And this is more in my industry, let's say, because I feel like they would say, oh, well, she doesn't have kids, and so she has more time. No, not necessarily.
No, right?
Just because I don't have kids, that
Yeah.
means I'm repositioning my time in my life, right? So after I dealt with my journey with infertility, that was one of the biggest, but the next, because I won't say was the biggest, because the journey with infertility was the biggest hurdle in my life, right? After I just found out how to regain who I was and get peace and move forward. But it was kind of like a little stop for me as far as, okay, I don't want to go backwards. So it's like, I'm not going to entertain this, whether it's happening for real or it's happening in my head. But I just felt like it was a real thing that was going on, which was like I had to explain to people that, well, I am busy. Like I'm really busy.
Right.
So being intentional now with my time is being, with my husband. I was a caregiver for 5 years, and being intentional with taking care of my mom. So all of that was done with intention. And so moving ahead, that's, I pick and choose the events. I'm an event planner, so now I do less events because I have the events that I want, right?
Right.
So it's now repositioning your life as it goes further.
Yeah.
So other than your services, describe any other types of resources or support available for anyone going through infertility.
Sure. And like you even shared in your story, you met one helping professional. There was no connection, and so you never went back. Research tells us that more than 50% of the time when Latinas do meet a counselor, they don't come back. So your story is not uncommon. And so sometimes the counseling connection or relationship isn't found, and that's not the support for you. So other resources are, one is resolve.org. They're the National Infertility Organization. They are also being more intentional about having Latina focused resources. And so that's one place, go-to place. There's also on Instagram, there's Latina specific infertility communities, right. I guess, that are there that give you little tips or videos or podcasts like this. There's also Resolve, Instagram. I know there's places there. And yeah, I would say, and one thing with being intentional and now with my career path, with my business as well, because I want to be able to support more people. And there's only one of me. I am launching what I call Mama Counselor on the Go. So it's going to be like an online platform where there's videos and audio for people to download. So they can get Dr. Anna on the go when you need a little support on a topic, on a situation. Because like you said, I want to really maximize my time and have the highest impact that I can do. And so that's something I'm very excited about. That's up and coming. So as far as resources, I would start with resolve.org. The other organization I'm part of is the American Society for Reproductive Medicine. It's ASRM. And they have a big mental health professional group now. So we are growing in that organization to really amplify mental health. So there's resources there as well. So I would start there and follow me on Instagram. I'm under Charlandra Counseling, because then you can see who I friend, right, or who I'm connected with. And those are all other infertility professionals who focus on the Latina experience and in general. So those will link you to other resources too.
Awesome. So the ones that you mentioned, I'll put them also in the show notes and link them in there. So if you can have one superpower, what could it be? What would it be?
Yes, my superpower will be to read other people's minds.
Oh,
yes. I mean, I'm in psychology, right? I want to know what's going on in your mind.
And once you read them, what would you do?
I would know. I mean, I just think it's easier than I feel like, because I feel, we spend our time trying to figure out what do people mean by what they're saying and doing. At least I do as a mental health professional. So it'd be so much easier if I just read your mind. I'd have the answer.
That is so cool.
Yeah.
Because I get it. Like, it's harder. I think that would be cool in my industry as well. It's like, okay, where are you? What do you need help with?
Right.
But yeah, I mean, because it takes, I feel on the mental health profession piece, someone that's coming to you may hold back because they're unsure on how much,
Right.
they can share, or, how much they feel that they can share. And if you're just there and you can read their mind, it'll make it easier. It's
Exactly.
like, it's like, here,
Very, yes,
take this, do this.
exactly.
But
Save us a
yeah,
lot of time.
is there anything else you would like to share that you feel we didn't cover?
Well, I just want to thank you again for just having this open forum for us, because those that are listening now have two stories, two Latina women who struggled to get pregnant, who had different outcomes, and are here to give you strength and courage and that perseverance to know that you can have a family journey that is not normal, or the
Conventional.
conventional path, and you still will be okay, and you have a community here to support you, and that there's nothing wrong with you.
Whoever's listening and you hear our stories, and you see we had two different journeys. And even if we had the same journey as far as the outcome and all that with procedures, etc., it still would be unique to us because what we each feel is different, right?
Right.
And so I can confidently say that after 30 years, I feel like this is the moment for me to give back, to share that there are tools and resources, that it's important for, you to be able to proceed in knowing that you have support with people who understand the
Right.
words, the verbiage, the, feelings, some emotions. Again, we may not be feeling what you're feeling because we can never understand that. No one can understand what I felt through. No one can understand what Dr. Anna went through. But in essence, the journey is full of emotions and full of inconsistencies and full of, unknowns. Even if you're given an exact medical term to what you're going through,
Right.
still you're oblivious to everything because your emotions take over. So
Yes. Right.
I'm hopeful that whatever you're taking away from here, this conversation will help, that you'll reach out, or that you'll see that the tools and resources provided or mentioned here or in the show notes can guide you in some form or another.
Yes.
So in closing, what are at least like 3 to 4, if you want just three, but if you have 4 tips that you would like to share with our listeners?
Sure. Takeaways. First is to find a professional that you do connect with. And if you don't feel the emotional connection, keep looking. Please don't be the 50% who drop out and don't come back. Keep looking. There is a match for you. And 2 is to, even though we want to isolate, make connections. Make connections with those that you trust in your close circle, and maintain those connections, because that's going to really support you along the way. 3 is seek out the information. I know that can be overwhelming, but information and that knowledge truly is power, because you know what questions to ask and what to look for and how to advocate for your medical needs while you're pursuing reproductive treatment. And the 4th would be to continue to make your wellness an everyday activity, because like you shared in your story, all of our stories, I think all of us, we get so consumed by the family building journey that we forget about all the other basic needs. And that contributes to depression, anxiety, losing yourself in the process, burnout. And so that 4th tip is to maintain that wellness. So instead of your whole wellness circle being only fertility, only getting pregnant, remember we have eating, we have exercise, we have friends, we have going outside, all those things that maintain your wellness have to continue in order to really make it through this journey without losing yourself in the process.
Awesome. Well, thank you so much. I'm really excited that you were here and having this conversation. And I am sure that I'll probably reach out to you again to have a different conversation on more specifically on certain either procedures or whatnot.
Sure.
like you mentioned, donor and things like that. So
Mm-hmm.
maybe to break down a few things
Mm-hmm.
to bring clarity and understanding. But I'm really appreciative of your time and you being here and
Yeah.
sharing your expertise and
You're
sharing your
welcome.
story as well. So thank you.
You're welcome. Thank you very much.
Wow, what an insightful conversation I had with Dr. Ana Flores Locke. Thank you so much, Doctor, for joining me in this conversation in how to maintain during an infertility journey. Thank you, Doctor, for sharing your story, your journey, but also sharing some insightful tools and resources on how we can move on, even if everything that is in front of us seems so cloudy and unclear going through this journey of infertility. We had a conversation, not to take away from any other culture, but also as us being Latinas, having a conversation about infertility and our culture and understanding that it seemed like a taboo at times to talk about all of the different conversations that you could not have. I'm really grateful that we had this conversation. I'm hoping that based on our conversation, our listeners can either take one or two tips from the whole conversation or at least a breath of fresh air, that you know that there is a safe space to come to, that you know that there is help, that there are tools and resources for you to reach out to. So if you are going through infertility, reach out or at least take in this episode, hear it again. So, with that said, take care and stay tuned for the next episode of Inspired by Jacqueline. Take care.